2.5 minutes medicine presence. Snakebite. This is the sequence that I will follow through my presentation. 1. Introduction. 2. Pathophysiology. 3. Signs and symptoms. 4. Severity of envenomation. 5. Investigation. 6. Management. Starting with the introduction part. Of about 3,000 snake species throughout the world, only about 15% worldwide and 20% in the US are dangerous to humans because of venom or toxic salivary secretions. Let's start about the pathophysiology of snakebite. Snake venoms are complex substances, chiefly proteins, with enzymatic activity. Although enzymes play an important role, the lethal properties of venom are caused by certain smaller polypeptides. Diagrammatic illustration of snakebite pathophysiology. Here is the detailed list of signs and symptoms at the site of bite as well as systemic manifestations. Simpler and easier infographics of signs and symptoms. Severity of envenomation depends upon size and species of the snake. Amount of venom injected. Number of bites. Location and depth of the bite. Age, size, and health of the patient. Time elapsed before treatment. Patient's susceptibility, response to the venom. These are the set of investigation that are carried away. Complete blood count coagulation profile. Measurement of fibrin degradation products. Urinalysis. Serum electrolytes, blood urea nitrogen, and creatinine. ECG, CXR, creatine kinase. Again, the most important step of this presentation is management. It is divided into 4 steps for easier understanding. 1. First aid. 2. Supportive care. 3. Antivenom. 4. Wound care. In first aid, avoid exertion reassurance, keep warm, immobilize rings, watches, and constrictive clothing should be removed, transport to nearest medical facility. Respiratory support, benzodiazepines for anxiety and sedation, opioids for pain, fluid and vasopressor for shock. Transfusions may be required but should not be given before patients have received antivenom. Suspected anaphylaxis is treated with epinephrine. Tracheostomy may be needed if trismus, laryngeal spasm, or excessive salivation is present. A loading dose of 4 to 12 vials diluted in 250 ml of NS infused slowly at 20 to 50 ml per hour for the first 10 minutes. Then, if no adverse reactions, the remainder is infused over the next hour. The same dose can be repeated 2 times as needed to achieve initial control of symptoms, reverse coagulopathies, and correct physiologic parameters. Once control is achieved, a 2-vial dose in 250 ml saline is given at 6, 12, and 18 hours to prevent recurrence of limb swelling and other venom effects. Wound care includes tetanus prophylaxis, antibiotics in case of infection, wound cleaning, dressing, wound debridement, fasciotomy in case of compartment syndrome. Thanks for watching. Keep coming.